Greetings everyone, I am Dr. Rahul Kakkar. I am a psychiatrist and a de-addiction specialist. In this video, I will be discussing the most common mental health issue in almost all age groups, that is anxiety. As we all know, any situational change leads to a changed behavior, and difficult times like this COVID times have been known to increase the rate of anxiety issues. Anxiety disorders are often confused with feeling anxious, which is rather common and very much normal. Ordinary anxiety is a feeling that comes and goes. And anxiousness is our body's natural response to stress. It's a feeling of fear or apprehension about what's to come. For example, our first day of school or at the time of exams. And on the other hand, anxiety disorder can be established only when there are extreme episodes of anxiety for a duration of 6 or more months at least, thus causing dysfunctions in our everyday life. All of us might have experienced some of the anxiety symptoms in the times of stress. Some of the very common anxiety symptoms are irritability, decreased concentration, increased heart rate, rapid breathing, difficulty in falling asleep, headaches, and gastric problems. Some other ways people have also experienced anxiety are nightmares, flashbacks that we can't control. Anxiety is a key part of several disorders which are very common and you all might have heard of, like phobias, obsessive compulsive disorder, social anxiety disorder, generalized anxiety disorder, post-traumatic stress disorder, and panic disorder. So this sums up our basic understanding about anxiety, and now let's glance at the available treatment options. Treatment plan could be a mix of pharmacotherapy, psychotherapy, and some simple lifestyle and behavioral modifications. We will not be discussing about medications and psychotherapies here as it depends on individual to individual and should be supervised by a mental health professional. So let's focus on some simple and feasible lifestyle modifications which we should all practice in order to maintain our psychological well-being. First and most important is sleep regulation. You should all try and settle your bodies into a fixed sleep-wake cycle. You should try and avoid caffeine intake after 5 pm as it acts as a stimulant. And also you should avoid screen exposure or using mobile phones after going to bed. Next is time management. A proper time management reduces our stress levels significantly as it frees up a lot of headspace. For better time management, you should all make a to-do list. You should prioritize your tasks and pen down them. And try and give yourself deadlines in the aspect of time to finish a particular task. Next is diversion and distraction techniques. Any activity which requires active concentration will divert you from the thoughts causing anxiety. For example, 100 minus 7 minus 7 technique. Next is exercises. Both physical and breathing exercises, if they are practiced in routine, they help a lot and act as a stress reliever. There is a specific breathing technique called 4-7-8 technique in which you inhale through your nose to a mental count of 4, you hold your breath to a count of 7 and then you exhale completely to a count of 8. I hope the points elaborated will help you all. Thank you.